Nursing 345, skin, hair, and nails, and head, face, and neck. This first slide lists the objectives for this week, and they are comprehend the significant differences between the skin of the very young, the older adult, and the healthy adult. Describe the differentiation between normal and abnormal skin color for various ethnic groups. Identify the structures and landmarks of the neck. Describe the assessment that would follow the palpation of an abnormal lymph node. Identify the structures viewed through an ophthalmoscope. Discuss the three most common causes of decreased visual functioning in the older adult. State the functions of the inner ear that can be assessed. Incorporate health promotion concepts when performing an assessment of the ears. Acknowledge the effects of some of the age-related changes that take place in the mouth. Assess health promotion concepts when performing an assessment of the nose, mouth, and throat. So first we'll talk about skin. The skin is the body's largest organ system. It guards the body from environmental stress and adapts to other environmental influences. The skin has two layers. The epidermis is the thin, tough outer layer. The dermis is the inner supportive layer. The subcutaneous layer is the adipose tissue below the dermis. Epidermal appendages include hair, sebaceous and sweat glands, and nails. The skin is a waterproof covering that has several key functions. It offers protection, prevents penetration, allows perception, regulates temperature, allows identification, allows communication of emotions, repairs wounds, absorbs and excretes some metabolic wastes, and produces vitamin D. Significant differences exist in the skin at various developmental stages and with genetic and cultural variations. The immature skin of infants cannot effectively prevent fluid loss or regulate temperature. With newborns, you will find lanugo, vernix, caseosa, and sebum. Pregnancy causes pigment changes and stretch marks. Aging causes changes in the stratum corneum that give chemicals easier access to the body, change hair distribution, and causes other changes that lead to wrinkling. Melanin protects the skin against harmful ultraviolet rays, a genetic advantage among darkly pigmented individuals. To obtain subjective data, ask questions and investigate these topics. Past history of skin disease, such as allergies, hives, psoriasis, and eczema, change in pigmentation, change in a mole, excessive dryness or moisture, pruritus, excessive bruising, rash or lesion, any medications, hair loss, any change in nails, environmental or occupational hazards, and also you would want to find out about self-care behaviors. Obtain additional history data based on the patient's developmental stage. For an infant or a child, for example, ask about birthmarks, changes in the newborn skin color, diaper rash, burns or bruises, exposure to contagious skin conditions, and protection from sun exposure. For an adolescent, ask about pimples or acne. For aging adults, you should ask about skin changes in recent years, delay in wound healing, skin pain, history of falls, and issues with feet or toenails. To obtain objective data, inspect and palpate the skin. If indicated, put on gloves. First, observe color and general pigmentation. Normally, it is consistent with the patient's genetic background and varies from pinkish tan to ruddy dark or from light to dark brown, and may have yellow or olive overtones. Dark-skinned people normally have lighter pigmentation on palms, nail beds, and lips. Be alert to subtle skin tone changes and their relationship to the patient's general health. Besides examining for symmetric skin tone, inspect the mucous membranes, lips, nail beds, and sclera for color changes that may not be visible otherwise. Assess the skin temperature, moisture, texture, thickness, edema, mobility, turgor, vascularity or bruising, and lesions. If you see a lesion, note its color, elevation, shape, size, and location, and distribution on the body, and any exudate. Next, inspect and palpate the hair. noting its color, texture, and distribution. Also check for scalp lesions, including infestations. Inspect and palpate the nails, evaluating their shape and contour, consistency, and color. Assess capillary refill, which normally occurs immediately or in a few seconds. To promote health and self-care, teach about skin self-examination. This ABCDE skin assessment is a tool that can be easily remembered and shared with your patients. You need to teach avoidance of exposure to ultraviolet light, including tanning beds. Also provide appropriate developmental information, for example, infants with physiological jaundice. Teach older adults about age-related changes and what they can expect. The head includes the skull, a rigid bony box that protects the brain and special sense organs. Cranial bones unite at immovable joints called sutures. 14 facial bones articulate at sutures except the mandible, which has a movable temporomandibular joint anterior to each ear. The temporal artery lies superior to the temporalis muscle, and its pulsation is palpable anterior to the ear. The sublingual and submandibular salivary glands are accessible to examination, but the parotid glands in the cheeks over the mandible and are not normally palpable. The neck is bordered by the skull and mandible above the manubrium sternum, clavicle, first rib, and first thoracic vertebrae below. The carotid artery and the internal jugular vein lie beneath the sternomastoid muscle. The external jugular vein runs diagonally across this muscle. Along with nerves and lymphatics, parts of the respiratory and digestive system pass through the neck. The major neck muscles are the sternomastoid and the trapeze and are innervated by cranial nerve 11. The sternomastoid muscle divides each side of the neck into two triangles. It accomplishes head rotation and flexion. The anterior triangle extends to the mandible above and the midline of the body medially. The posterior triangle lies behind the sternomastoid muscle and in front of the trapeze. The thyroid gland is an important endocrine gland that straddles the trachea in the middle of the neck. The thyroid cartilage with a small palpable notch lies above the thyroid isthmus. The head and neck have a rich supply of lymph nodes. Their labels correspond to the adjacent structures. The pre-auricular nodes are located in front of the ear. The posterior auricular nodes lie superficial to the mastoid process. The occipital nodes are felt at the base of the skull. The submental nodes are midline structures behind the tip of the mandible. The submandibular nodes are found halfway between the angle of the mandible and its tip. The jugulogastric or tonsillar nodes exist under the angle of the mandible. The superficial cervical nodes overlay the sternomastoid muscles. The deep cervical nodes are deep under the sternomastoid muscles. The posterior cervical nodes appear in the posterior triangle along the edge of the trapeze muscles. The supraclavicular nodes are located just above and behind the clavicle at the sternomastoid muscle. The head and neck exhibit developmental changes. At birth, the head is larger than the chest circumference, and the neonate skull bones are separated by sutures and fontanelles. Lymphoid tissue is well developed at birth and grows to adult size by age 6. At age 10 or 11, lymph tissue exceeds adult size and then slowly atrophies. During pregnancy, the thyroid gland enlarges as a result of the hyperplasia of the tissue and increased vascularity. In aging adults, the facial bones and orbits appear more prominent as the facial skin sags because of decreased elasticity, moisture, and subcutaneous fat. To obtain subjective data, you need to ask questions that investigate the following topics, which include headache, head injury, dizziness, neck pain or limited range of motion, numbness or tingling, lumps or swelling, difficulty swallowing, a history of smoking, or a history of head or neck surgery. For infants and children, you need to ask the mother if she used alcohol or street drugs, whether the birth was vaginal or cesarean delivery, and about the baby's growth. For aging adults, ask about dizziness, ability to drive safely, and ability to sleep. To obtain objective data, first inspect and palpate the skull. Observe its size and shape and note any deformities, lumps, or tenderness. Palpate the temporal artery with the temporomandibular joint. Next, inspect the face. Note the facial expression and symmetry of movement, which reflect the functioning of cranial nerve 7. Also observe any involuntary movements, edema, or lesions. Inspect and palpate the neck. Check for symmetry of head position and active range of motion. Palpate for enlargement of lymph nodes, salivary glands, and thyroid glands. Palpate the position of the trachea, which is shown on your slide. If palpation reveals lymph node abnormalities, explore the area proximal to the affected node. This requires being familiar with lymphatic drainage. If the thyroid is enlarged, auscultate it for Broad's, a soft whooshing sound. The trachea is normally midline. Perform additional assessment based on the patient's developmental stage. For instance, in an infant, measure the head size, palpate the fontanelles, and note the tonic neck reflex. In a pregnant woman, assess for a blotchy hyperpigment area over the cheeks and forehead and thyroid gland enlargement. In an aging adult, observe for prominent temporal arteries and senile tremors. So here's a checklist for head, face, neck, including regional lymphatics assessment. You would inspect and palpate the skin, note general size and contour, note any deformities, palpate the temporal artery and the TMG joint. Inspect and palpate the face, observe facial expression, cranial nerve 7, symmetry of movement, observe for any abnormal movements, and inspect and palpate the neck. You would look for range of motion and potential enlargement and position of the trachea. Auscultate the thyroid if it's enlarged for Broad. This last slide is notes for the head, face, and neck part. So subjective, the sample note states, denies any unusually frequent or severe headache, no history of head injury, dizziness, or syncope, no neck pain, limitation of motion, lumps, or swelling. The objective note for head, face, and neck is head is normocephalic, no lumps, no lesions, no tenderness. Face, symmetric, no weakness or drooping, no involuntary movements. Neck, supple with full range of motion, no pain. Symmetric, no lymphadenopathy or masses. Trachea is midline, thyroid not palpable, no Broads. And lastly, the assessment would be normocephalic, symmetric head and neck.